What up, Scruff family? How you doing? Uncle Scruff hasn't really talked to y'all in a minute. I did a short one yesterday, but this one gets on my nerves. Okay, you've got California, part of the United States. First state as of January 1st this year to offer illegal immigrants free health care.
That this new move is actually expanding the access to 700,000 additional undocumented migrants who didn't have full coverage before. Some undocumented people only had access to emergency services but didn't receive health insurance. It's why there's some concern. Most local officials are not okay with it, and they have a problem with it. And I want to bring up Supervisor Jim Desmond, who in a statement wrote in part, quote, "The county of San Diego is spending over $1 million per month on migrant services from local tax dollars earmarked for housing and homelessness. Our local resources are meant to address our community's needs, not fund services for those who have just entered our country." El Cajon Mayor Bill Wells also slammed the new move, saying our state faces an array of challenges, but instead of focusing on the needs of tax-paying citizens, it is placing illegal immigrants at the front of the line by providing free health care for undocumented immigrants. Public assistance has ballooned to become the second biggest government expense for the county of San Diego. Now, Medi-Cal is the state's health insurance program for low-income people. It offers access to primary and preventative care specialists, prescription medicine, and other services. The expansion now includes undocumented people between the ages of 26 and 49. It used to cover undocumented children, young adults, and seniors. DACA recipients say the state is moving in the right direction, and they believe that there's still more work to be done.
We really have to continue including more folks and to not kind of forget about the ones who just make a little bit over.
And many undocumented Californians might still be ineligible for Medi-Cal just because they make too much money to qualify, but they make too little to qualify for private insurance. So it's still up in the air as to how many will be eligible for Medi-Cal. That's the latest in downtown. Regina Urita, CBS 8.
Okay. You've got, what is it? I don't know if it's Ohio, Illinois, some state in the country that's in the middle of the country. They're letting illegal immigrants become police officers. Okay. Now, you come to New York. Every illegal immigrant is here. They're getting food. They're getting food stamps. And I don't really have a problem with it. But when our people, the United States citizens, want health care, this is what they do.
Here with no clothes on?
When a man witnessed people wheeling a woman from a hospital to a bus stop and leaving her there, he had some questions.
That is not okay.
Due to the circumstances of what it was.
Then you.
Did he just say, due to the circumstances that it was? Run that back.
Due to the circumstances of what it was.
Then you all need to call the police.
The witness posted video of the incident to Facebook, which he says happened at a hospital in Baltimore, Maryland.
Ladies and gentlemen, I'm at a local hospital where individuals have left a patient half naked on the city streets, and it's about 30 degrees out here right now. Ma'am, are you okay?
In more than 6 minutes of video, the woman seemed disoriented and distraught.
Ma'am, come and sit down. Let me get you some help. Come and sit down. Come on. I know it's cool.
The witness, who says he's a psychotherapist in the city, stayed with the woman while an ambulance was called. He says the ambulance picked the woman up and then brought her back to the same hospital that discharged her.
I'm disgusted by the display or the lack of empathy that I am seeing displayed.
Officials at the University of Maryland Medical Center thanked the witness for bringing the incident to their attention.
We take full responsibility for this failure, And we are examining our policies and our procedures to ensure that this type of event does not happen again.
It is unclear where the patient is now, but the hospital also said it will review its employees' actions and will evaluate the appropriate response.
So now what you're seeing is you're paying your taxes. You can't have free health care. Someone from outside the country can come in and get health care. But when you need health care, they dump you in the street. Good old capitalism. Thank you, America. Uncle Scruff, I'm out.